From finding a plan to filing a claim, there are a lot of questions when it comes to buying and using visitors' health insurance plans. Here are 11 tips to help you buy a travel medical insurance plan for your visiting parents or family to the USA. Now let's jump into it. Know what your needs are before buying a plan. Are you looking for coverage for pre-existing conditions? Do you want a plan with direct billing? Do you need a plan that will provide coverage for a few days or a few months? There's a lot to consider and learn when shopping for the right plan. When searching for a plan on G1G, our AI tool, Itira, will ask a series of questions and help determine what you're after and match you with the best available plans. A visitor's insurance plan can be a significant financial investment as well, so you want to be sure you get the best available plan for your budget. Buy from a US-based company. The US healthcare system is intricate. There are many levers and knobs that get pulled and turned whenever someone receives care. Even most US residents aren't fully aware of how the healthcare system functions, and it can often feel overwhelming. Licensed agents in the United States have strict guidelines to follow before they can begin selling travel insurance. This helps ensure that they understand coverage and are ethical in their practices. US-based providers typically offer higher benefits and more coverage than foreign-based providers. Additionally, foreign providers might not immediately be recognized by US healthcare practitioners, which means bills don't always get paid quickly and efficiently. Also, what's important to remember is that the price of insurance is regulated by law in the United States. So this means the same plan wherever it's purchased through an airline, a travel agent, directly from the insurance company, or a travel insurance comparison site will always cost exactly the same amount. Some comparison sites even partner with underwriters to create and offer their own travel insurance plans. However, when you see a comparison site push its own custom plan, just know that company is probably getting a larger commission from that sale than from the other plans listed. You can imagine the conflicts of interest that might arise with that kind of a thing. The G1G is the only major travel insurance comparison site that doesn't sell its own custom insurance products. This is by design. This means we have no incentive to push one product over the others because of any financial benefits to ourselves. The only thing that matters is that you get the best plan and coverage for your travel needs and budget. We recommend purchasing a comprehensive coverage plan for your loved ones on their trip to the USA. There are two main types of visitors insurance plans: comprehensive coverage and limited benefits plans. We have several videos going into the weeds of what they are, so be sure to check that out if you want more information on that. In short, comprehensive benefit plans offer the best coverage options. However, these plans are more expensive than limited benefit plans. Comprehensive plans also offer travel benefits for interruptions and lost baggage, which give you an added layer of protection in the event you have to cut your trip short because you got sick or hurt. There are types of plans that also give you access to a PPO or provider network. A provider network opens you up for direct billing options. This means a hospital or provider will bill the insurance company directly, saving you the hassle and financial burden of having to pay out of pocket and then look later for reimbursement from the insurance company. Limited benefit plans are the budget option when compared to comprehensive plans. You pay less upfront, but you receive less in benefits and can stand to pay a lot more out of pocket. So, unlike comprehensive plans, limited plans itemize the services that you receive for each medical visit. Instead of paying a maximum amount for the overall visit, each individual service will be paid for with its own benefit limit. At the end of the day, a comprehensive plan is the best way to limit your exposure to the financial risk associated with travel, and what we recommend for visitors to the USA. It is overall the best investment you can make, but we understand it isn't realistic for every traveler's budget. We recommend browsing the provider network before you actually need to use the plan. Know where the nearest eligible hospitals and treatment centers are. Identify a few urgent care centers within your network. Have your ID card either printed out or saved on your smartphone. Have all the necessary phone numbers close at hand. In general, the better you know your plan, the more value you can get from it. Don't wait to get treatment if your loved one gets ill or injured. Most plans require that treatment is obtained within 24 to 48 hours of symptoms. Also, depending on the severity of the injury or illness, consider visiting urgent care and not the emergency room. Now, that'll often result in not only saving money, but more importantly, saving time and getting treatment quicker. We recommend never co-signing on behalf of a patient, regardless if they're your parents, siblings, friends, what have you. The patient should always sign for their own treatment and use their own insurance. By co-signing, you might become legally responsible for paying the cost of treatment if, say, the insurance company denies the claim. The thing is that hospitals in the USA are legally required to treat all patients. While this is definitely the right thing to do, this means that they will come to collect bills after treatment. A related tip, and maybe an obvious one, always read what you're asked to sign at a hospital or treatment center. Get clarification on things that seem confusing or out of place. Make sure you retain copies of the things that you signed as well for your own records and any claims-related documents as well. Most visitors' insurance plans do not cover coverage prescription drugs unless they're required for covered treatment of any accidental injury or illness you incur on your travels. So what that means is plan ahead. Make sure you or your traveling loved ones take an adequate amount of medication to last their trip, including some extra days in case the trip gets extended. Now also note that all G1G plans come with a prescription discount card, which translates to savings at US pharmacies. This one might sound obvious, but don't forget to file a claim, even if you have a plan with direct billing and your hospital or treatment center is sending the bills and receipts to the insurance company. Don't forget to file a claim. Also, here's the thing about buying directly from the insurance company. More often than not, you'll get little to no support in navigating the claims process from them. With G1G, every plan comes with claims advocacy, so we'll be right there with you throughout the process. If you think your claim was legitimate and has been incorrectly denied, you can file an appeal. The U.S. Travel Insurance Association reports that 1 out of 6 travelers end up filing a claim. Out of those, less than 10% are denied. Sometimes, claims are denied because a form was filled out incorrectly, records are missing, or some other procedural step wasn't done right. If that was the case, you can correct those issues and resubmit a claim. If the claim is denied, the insurance company will send what's called an explanation of benefits or other documents that clarify why a claim was denied. Each company will specify a procedure and time frame, usually between 30 and 90 days, in which an appeal is filed. If you miss that time frame, you can't file an appeal if your claim was otherwise payable. To file an appeal with chances of success, you should do your diligence to understand why a claim was denied and provide the appropriate documentation on why the claim should be paid. This includes any letters from doctors or healthcare providers, any past medical records or other information that would help the insurance company reconsider the claim. Every G1G plan comes with free claims advocacy. If your claim is denied, we'll work with you to get to the bottom line of it and make sure the conclusion reached was fair and accurate. If the insurance company doesn't pay the bills or stops responding, contact your state insurance commissioner or your state attorney general's offices, and they could step in to help get a response from the insurance company. So that's it for some tips for choosing and using a visitor's insurance plan. We at G1G are a travel tech company founded and based in the San Francisco Bay Area, and we make a profit when you buy visitors insurance plans from us. So I want that to be clear. However, we verify and vet all of the companies and plans that we offer. So visit our website to learn more about these plans and all things travel and visitors insurance. Remember, this video is meant to serve as general education information. Nothing here is medical advice. Always check plan documents and specific benefit definitions, coverage amounts, exclusions, and limitations. Enjoy the journey.